Okay, so hypertrophic cardiomyopathy is the leading cause of sudden cardiac death in athletes in the United States under the age of 35. The genetic disorder is characterized by abnormally hypertrophed but non-dilated left ventricle in the absence of psychological conditions such as physical training or pathological conditions like aortic stenosis or hypertension that would result in left ventricular hypertrophy. More than 400 specific mutations within genes have been identified. The prevalence of HCM is estimated at 1 in 500 in the general population and is more prevalent in males of African American descent. So the walls of the ventricle thicken in a vibral pattern in HCM as often as 28% of the time. Physical obstruction of blood flow occurs during systole. Up to 80% of individuals with HCM have abnormally small coronary arteries that may cause ischemia. Cellular abnormalities include myofibrillar disorganization and death, with resultant fibrotic scarring. Although outflow obstruction can occur, the presence of left ventricular diastolic dysfunction is more common. Either outflow obstruction or diastolic dysfunction can impair exercise performance. Both decreased wall densibility and incomplete myocardial relaxation contribute to altered left ventricle filling, which leads to left atrial dilation. Regional myocardial ischemia likely occurs because of the abnormally small coronary arteries and inadequate capillary density. Adding random fibrosis of the cardiac musculature proceeds a combination of ischemia, fibrosis, and vasodilator reserve that can lead to arrhythmia and sudden death.
There are two types, obstructive and non-obstructive. Obstructive is the most common, and some signs and symptoms are arrhythmia, which is irregular heart rate or rhythm, chest pain, especially during activity, fatigue, fluttering or pounding feeling in your chest, heart murmur, lightheadedness or dizziness, fainting, shortness of breath, especially during activity, and swelling in the feet, ankles, legs, belly, and neck.
Diagnosing hypertrophic cardiomyopathy. Number 1, the echocardiogram. This test uses sound waves or an ultrasound to see if the heart muscle is unusually thick. It also shows where the heart chambers and muscle valves are pumping blood. Number 2, electrocardiogram. Sensors are attached to adhesive pads, which are then attached to the chest or the legs to measure electrical signals from the heart. It shows irregular heart rhythms and thickening of the heart. Number 3, cardiac MRI. This test uses powerful magnets and radio waves to create images of the heart. It shows the heart muscles and how the valves are working. Lastly, the stress test. This is when a patient is riding a stationary bike or walking on a treadmill while the heart is beating.
So we have 3 main types of treatment, and they consist of self-care, medications, and devices. For self-care, you're going to want to watch the exercises that you do so that you don't put too much strain on your heart. Medications, we have our beta blockers and our antihypertensive drug. For devices, we have our pacemakers, which basically helps with your heart rhythm.
Detection of HCM can be difficult, but the patient's medical history is invaluable. A comprehensive medical history can reveal an autosomal dominant transmission pattern, a family history of cardiac disease, or a record of other premature sudden deaths in family members.